Good afternoon. Thank you for joining me today. First, I would like to offer condolences to the friends and family of former MLA Aaron Babcock, who passed away this weekend after a prolonged battle with cancer. Aaron represented the riding of a Sawhney Plain from 2015 to 2019, was only 38 years old, an LPN by profession, and most important of all, she was a mother of 3. I did not have the chance to meet Erin, but a biographic article written shortly after she was elected said that Erin was raised in a family of strong women, where political discussion was part of dinnertime table talk. And I know she was well regarded from all sides of the Assembly. And today, we offer heartfelt condolences and sympathy to all those who are grieving the loss of a loved one at this time. In regard to COVID-19, each and every one of us has experienced some challenging situations and difficult choices in the past couple of months. We are all doing what we can to limit the spread of the COVID-19 virus, and for that, I thank you. Your sacrifices are helping to save lives. Our ministry and staff are also working tirelessly to protect people in this time of need. Vulnerable Albertans, whether persons with disabilities, people struggling with homelessness, those dealing with unemployment, or those impacted by isolation and physical distancing, need our help. We are working to make sure people in need have food on the table and roofs over their head. Everyone has a part to play in this pandemic, and I'm proud of everyone for demonstrating their ability to work as one and rise to the task when our communities are in need. Thanks to all the nonprofits and charitable organizations who are working to support vulnerable Albertans. Without your support and continued partnership, this already difficult situation would be even more challenging. I want to thank the staff from my department and those who provide frontline services who are working tirelessly to ensure that challenges are met with creative solutions and the people who need our help are taken care of. As an unprecedented public health emergency, COVID-19 poses a serious threat to our vulnerable populations. Right now, many people are struggling and are unsure about the future. I hear their stories through direct conversations, letters, and phone calls to my office and from my staff. And the impact this crisis is having on so many is truly, truly heartbreaking. I want to assure Albertans that we hear you, and we are doing everything that we can to help you. We are committed to maintaining CSS programs and services, including PDD, FSED, AISH, and income support during the pandemic. Whether you are receiving social assistance or may have lost income, whether you are caring for a loved one with a disability and need more support with respite and in-home supports, such as childcare, whether you're homeless and need a place to stay, if you need access to food or other necessities, or if you are experiencing domestic violence, we are taking action to help you through this very difficult time. Many Albertans have lost most, if not all, of their income through job loss or reduced hours. This includes Albertans who receive social assistance through programs like Assured Income for the severely handicapped or AISH, or income support. These programs allow recipients to earn some additional employment income without impacting their benefits. Additional employment income that now may suddenly be gone. I know Albertans who receive benefits through AISH or income support want to apply for the Canada Emergency Response Benefit, or CERB, to recoup some of their lost income. But they are concerned that accessing CERB may affect their eligibility for provincial benefits. That's why we are taking action to exempt a portion of CERB payments so the financial benefits from AISH and income supports can be calculated similar to before they lost their jobs, and they can still receive the same health benefits. For those who need additional assistance, they may qualify for emergency benefits. With this change, I hope Albertans receiving benefits will have peace of mind, that they will still get the financial support they need to take care of themselves and their families. I have also heard from families caring for loved ones with disabilities. This is an especially challenging time for you. You have concerns about access to supports like childcare and in-home respite. We know each family situation is different and that some people are relying on loved ones, friends, and neighbors for support. And many of you are doing without the programs and staffing that you usually rely on, as there may be limitations on available resources you counted on before the pandemic. We are working on short-term changes to our policies to make sure families accessing our Family Support for Children with Disabilities, or the FSCD program, and persons with developmental disabilities, or PDD, programs have the flexibility that they need at this time. We will post more details about these changes online in the coming days. I do want to be clear that these will be temporary changes and regular policies will return after the state of public health emergency ends. I encourage families to connect with their caseworkers to adjust any supports and services as their needs change. We have also developed a plain language COVID-19 guide for people with disabilities. This reference helps explain COVID-19 and provides information on what people can do to stay safe and help prevent the spread of the virus. The guide is available online, and we will also share it with disability organizations and self-advocates across the province. We all share a responsibility to protect each other, and our hope is that this guide will help. We are also making efforts to address food supply issues during this pandemic. No one should go hungry during an already stressful time. We want to make sure vulnerable Albertans are able to access food for themselves and their families. That is why we are providing $5 million to support Alberta's food banks and other organizations who focus on addressing food access issues. We received 49 applications for funding from food banks and are currently reviewing these applications to make final funding decisions. Also, Food Banks Canada was recently provided with $50 million in federal funding to support food security. And we are working with the federal government and Alberta Food Banks to ensure provincial and federal funding are used to maximize the number of people who are going to be supported. As I previously mentioned, we are providing $30 million in emergency social services funding to charities, not-for-profits, and civil society organizations to support their COVID-19 response. We have received 850 applications from organizations across the province for this funding. As of April 21st, we suspended applications for this funding in order to review and prioritize the most urgent requests. Our staff are working hard to ensure the funding is used to help Albertans who are most in need at this time. We are encouraged by the successes of our community partners in providing shelter, food, and necessary services to people in need during this pandemic. I have also committed to providing regular updates on our work to support people struggling with homelessness. As was announced last week by Dr. Hinshaw, we are beginning asymptomatic testing in homeless shelters. This is a joint initiative led by Alberta Health and Alberta Health Services. Our government acted quickly to mobilize shelter operators and community organizations to create surge capacity and isolation beds for people in shelters. And now, 14 additional shelters are operational in Edmonton, Calgary, Red Deer, Lethbridge, and Grand Prairie. In addition, we have identified and activated hotels and motels as isolation centers to ensure individuals affected by COVID-19 are isolating in a space that protects their health and their well-being. Across the province, we have identified up to 194 hotel rooms to shelter people who are symptomatic, in addition to the 200 spaces in Edmonton. We know shelters and surge capacity efforts are a temporary solution, but the best outcome is to move people into their own homes. and that is our focus now. We continue to work with the shelter operators and community organizations who are expanding their housing efforts. Across the province, since March, shelters and community-based organizations have collectively housed more than 400 people. This is a remarkable accomplishment, but much more work remains to be done on this front. I would also like to report that I was notified earlier today that 2 individuals who have stayed at the Calgary Drop-In Centre have tested positive for COVID-19. Appropriate precautions are being taken, and AHS is engaged in managing the next steps. We also know that during a crisis like this, there is an increase in domestic violence, and we must do whatever we can to protect those who experience abuse. We have provided an additional $5 million to women's emergency shelters, second-stage shelters, elder abuse shelters, and family violence counseling and outreach programs. Funding will be used to help families access hotel rooms for safe isolation, pay for food, transportation, and other needs. Shelters can also use this money to hire temporary staff to improve access to their service and ensure the supports they offer align with physical distancing requirements. I'd like to end by saying once again, thank you to everyone for your hard work and for your support. We will continue to do what we can to help our most vulnerable and at-risk people in getting access to necessary supports and services. I'm very encouraged by the efforts everyone has made to adapt to this public health crisis, support their neighbours, and follow public health guidelines. I will now be happy to take any questions.
Thank you, Minister. We'll now go to the phones. We have Tim Brock on the line.
Tim, your line is open.
Hi, thanks so much. My question revolves around the asymptomatic testing that you just mentioned in shelters. Can you just give us a better idea of, number one, when that's going to start, and number two, what exactly it's going to look like? What's kind of the plan of attack here?
Yes, thank you for that question. So the asymptomatic testing is going to start immediately. It was announced last week by Dr. Hinshaw, and the plan in terms of what it's going to look like has been designed by Alberta Health Services, and we can certainly provide more information on that tomorrow during Dr. Hinshaw's media avail.
Okay, so you don't have any specifics. I mean, it's quite the undertaking. Can you maybe kind of give us some kind of hint of what it's going to look like, how it's going to be organized? Because obviously the homeless population in both Calgary and Edmonton is very large.
Yes, you're right. You're right. Both populations are very large in those cities, and of course we have populations dispersed across the province. In terms of providing more detail, I don't have that information. That really has been designed by Alberta Health. They have indicated urban centres, most likely Calgary, to be the first city in which they'll undertake asymptomatic testing. But beyond that, I don't have many details that I can share with you. This is definitely a question for Dr. Hinshaw.
All right, thank you.
Thank you.
Thank you, everyone. Thanks for joining us on the line to the media, and that ends our availability for today.
Thank you.